I'm Bob Sherman. I'm a respiratory therapist, and I'm addressing the difference between chronic bronchitis and acute bronchitis. Bronchitis is an inflammation of the bronchial tubes in the lungs, or the bronchi as they're called. But acute bronchitis and chronic bronchitis are two very different disease states. Acute bronchitis is brought on by an infection. Chronic bronchitis, on the other hand, is a component of COPD, or chronic obstructive pulmonary disease. It's brought on over a period of years by exposure to some lung irritants. Primarily people who smoke will eventually get chronic bronchitis. About 90% of the time that'll be a viral infection. It usually will resolve itself in the matter of days to a week or so, with or without treatment. So it's characterized by a dry, kind of hacking cough. The person may experience some shortness of breath, chest tightness, usually some wheezing on exhale associated with that, and fatigue. The clinical diagnosis of chronic bronchitis requires at least 3 consecutive months of a productive cough in 2 consecutive years. And that's how they make the diagnosis of chronic bronchitis. You can also see some swelling of the legs and feet and ankles associated with that, increase in fatigue, chest tightness, and sometimes even chest pain where you have some consolidation or areas of the lung where the air sacs have collapsed, can cause some discomfort in the lungs. The treatment for chronic bronchitis is basically a maintenance type of treatment. You're not going to get chronic bronchitis to resolve itself or get better. It's a progressive disease. It's only going to get worse. It can be stopped in its tracks by a cessation of smoking. So if you have some of these symptoms and you smoke, you need to quit smoking. The maintenance is basically to try to make the person reduce the shortness of breath and reduce the incidence of having the productive cough, and you don't want to end up getting an infection in your lungs, which chronic bronchitis can lead to quite frequently. So again, acute bronchitis brought on by some type of an infection usually resolves itself. Chronic bronchitis is a progressive, long-term disease. It's a component of COPD. That's how I see it as a respiratory therapist. I would recommend that you reach out to your doctor for more details, or go to Google and type in chronic asthmatic bronchitis for more information.